Hi, this is Dr. Marty Ross, and this is my Lyme disease antibiotic guide. This is about how you build a treatment using both herbal or prescription antibiotics. So stay tuned. There's a lot of information here. So I've also got a written version of this article as well. And to find that, click on a link that I have in the description for this video. Treat Lyme is supported by purchases you make through Marty Ross MD supplements. So in designing a Lyme disease treatment, there are 4 general rules that I like to use, and you can see them on the screen here. All right. So number 1, I like to combine antibiotics that treat all forms of the Lyme germ. Okay. So we think that Lyme exists as something called a spirochete. That's the thing that looks like a corkscrew. You probably have seen pictures of that on the internet. All right. That has a covering on it. All right. We also think that Lyme exists in another form, which goes by many different names. Sometimes it's called a cyst form, sometimes it's called a round body, sometimes it's called an L form. All right, so those are generally the 2 forms. Okay, all right. Number 2, Lyme lives inside of your cells, and Lyme lives outside of your cells. So we have to choose antibiotics that are going to be able to treat Lyme in both of those places. Now, I would point out that the Infectious Disease Society of America and the infectious disease doctors only think Lyme lives outside the cells. They disagree with the science that actually says it does live in the cells, but there's some pretty compelling science that says it does live in the cells, okay? All right. Third thing is I like to work with antibiotics, combine antibiotics that work differently. So you work with things that don't do the same exact thing, but build on each other by having different mechanisms by what they work, okay? And then rule 4, and sometimes I fudge this rule just a little bit, I try not to use more than 3 different herbal or prescription antibiotics at a time. And the reason I have that general rule of thumb is that's a way of decreasing the amount of toxicity in a person, okay? All right, so those are the kind of the principles I use and how I design a Lyme disease treatment, okay? This next part is about the different families of Lyme disease antibiotics, all right? So first of all, there's a group of antibiotics called the penicillins. I'm just highlighting it here on the screen so you can see it, all right? So penicillins are things like amoxicillin. There's also an injectable form called bicillin, and there's something called augmentin. And these are antibiotics that treat the covering of the spirochete. They're called cell wall agents, okay? Another family of antibiotics that's actually quite similar because they come from a same group of antibiotics, and that's the cephalosporins. And these would be things like IV Rocephin. There might be something called Omnicef. There's something called cefuroxime, okay? These also are cell wall agents and primarily are used in a Lyme disease treatment to treat the covering of the spirochete, okay? And they work outside of the cells. They don't go inside the cells, all right? Next major group of antibiotics are the tetracyclines. I'm just highlighting it here. And these would be doxycycline, minocycline, tetracycline, all right? And these are antibiotics that can work on the spirochete by getting to the inside of it. And they also work, get inside of cells so they can treat intracellular Lyme. And the main way that they work is they block protein production of the germ so it has a hard time growing. Eventually it withers and dies, okay? A family of antibiotics that acts very similar to that is this family called the macrolides. And macrolides would be clarithromycin, also called Biaxin. Another antibiotic called Zithromax or azithromycin would be in that family. They also work in a similar way to the tetracyclines in that they block protein production too, but in a slightly different way, okay? Now, the macrolides are used to treat spirochete Lyme because they get inside the spirochete. They also are used to treat Lyme that lives inside cells. Okay, so they get at that intracellular space that I was telling you about before. All right. Okay. Next big family is a group of antibiotics we call the azoles. And these would be things like tinidazole, which is also called Tindamax, another one called Flagyl, which is also known as metronidazole. Okay. And so the azoles, although there's limited science of showing that they work, or proving that they help, many of us use them to treat the cyst form of Lyme. They also work in the intracellular space as well too, okay? And basically, they work by making it so various bacteria enzymes don't work correctly, and they destabilize the DNA of the germ. All right, but most of us are probably going to use them primarily for their anti-cyst activities. Okay, all right. All right. The next group of antibiotics that can be used in Lyme disease treatment is this family called rifamycins. This would be things like rifampin or something also called rifabutin. All right, and primarily for the Lyme germ, they're going to be used more as anti-cyst agents, and they're also going to be used because they can get inside of the cell. So they treat Lyme that also exists in the intracellular space. And similar to the azoles, they basically deal with destabilizing the DNA of the germ by preventing production of RNA from cell DNA. RNA is what is used to create proteins ultimately in cells. Okay, all right. All right. Another family of antibiotics that can be used, and mainly I might use this if I was trying to think about designing something to treat persister Lyme. There's a group of antibiotics called the sulfa antibiotics. These would be things like Bactrim or Septra. Also the generic form of those, something called sulfamethoxazole and trimethoprim. And when I say persister is a form of Lyme that after it's been exposed to antibiotics for a while just goes into hibernation, slows its metabolism way down, and ignores antibiotics. And there's some petri dish experiments by Ying Zhang, medical doctor out of Hopkins, that shows that these may help treat those persister forms. Okay. All right. So another family of antibiotics called the quinine derivatives. These would be things that are similar to quinine, the big one being Plaquenil. Now, some of my colleagues will use Plaquenil because there's some old research showing that it might treat cyst Lyme. However, there's competing evidence that shows that maybe it causes more cyst Lyme to grow. The bigger reason that many of us use these, though, is that they change the acid environment inside of cells. They make it less acidic and more basic. And in a more basic environment, it makes it easier for intracellular antibiotics like the macrolides and the tetracyclines to work better. Okay? Then we get into some of the herbal options. Grapefruit seed extract is an herb. I didn't say grape seed extract, I say grapefruit seed extract. Can be used based on some petri dish experiments to treat the cyst form of the Lyme germ. Another thing I like to do is use an herbal combination. I call that option 1 here, using a cat's claw and otoba bark. Those two herbs have some pretty compelling petri dish experiments that show that they can treat Lyme inside, or that they can treat the different forms of the Lyme germ. Based on clinical response, I think they treat intracellular Lyme as well too. And they also do another benefit, and they break down a slime layer that Lyme develops called a biofilm. Okay, all right. There's another herbal combination that I like using, and I'll call that combination number 2. And it goes by a proprietary name of Biocidin LSF. This thing has got a large number of components to it, so I'm not going to read them all off. You could read the full article about this. But these seem to work on Lyme living inside and outside of the cells. And they seem, based on petri dish experiments, to do a good job of treating both cyst and spirochete forms of the germ. They also appear to block some of the mechanisms that germs use to develop antibiotic resistance. So even using these with prescription antibiotics may make it so there is less antibiotic resistance to those prescriptions as well too. Okay? So in this next part, I want to cover how you might put different antibiotics together, and I'm going to give you some samples. Okay? So the first thing I want to talk about, though, is this concept of persister Lyme. And this is a new area where we're now aware that Lyme germs have the ability, after they've been exposed to antibiotics for a while, to go into hibernation and basically start ignoring the antibiotics, okay? So there's research being done on various combinations of antibiotics that you might use, or even oils that you might use to deal with this. And so I have a full article about persister Lyme. that you might want to take a look at, and so it's called How to Treat Persistent Lyme, What Works. I'm going to steer you to that. I will point out, though, that there are 2 antibiotics that, as I'm recording this in August of 2019, that are kind of the new kids on the block that are catching quite a bit of attention. One is a medication called Dapsone that we had previously used to treat leprosy, actually. And it seems to give some good improvements when it's combined with a variety of intracellular antibiotics, as well as rifampin, okay? All right. The newest kid on the block, though, is a drug called Antibiotics that we have historically used to treat alcoholism, actually. But it has some antibiotic activities, and specifically has some antibiotic activities against persisters. And there's just some beginnings of research coming out in this that are showing that people can get some pretty nice improvements with this too. So on my Lyme disease information site called Treat Lyme by Marty Ross MD, I have a whole article about Antibiotics too. Okay? All right. Now, in terms of how different combinations, I'm just going to go through some. So one thing you could do is you could put together a macrolide plus an azole. Okay, so this would be like a Biaxin combined with tinidazole. So you've got tinidazole treating the cyst here, and Biaxin is treating both spirochete and intracellular Lyme. Okay, all right. Another combination you could put together is a macrolide plus a quinine derivative plus an azole. All right, so it'd be like Zithromax along with Plaquenil. And what the Plaquenil is doing in here is it's helping the Zithromax work better at treating the spirochete and also at treating intracellular Lyme by making the inside of those more basic, less acidic, okay? All right? And then the Flagyl here, which would be your azole, would be your anti-cyst agent, all right? Another example is to use a macrolide plus grapefruit seed extract, and that would be to use like a Biaxin, which is called clarithromycin, combined with grapefruit seed extract. Again, the clarithromycin is your anti-spirochete agent and also is treating intracellular Lyme. Grapefruit extract, in this example, is treating the cyst form of the Lyme germ. Okay. Another example is to use a tetracycline plus a macrolide plus a grapefruit seed extract. Okay. Now remember earlier I said tetracyclines work in a very similar way to the macrolides. They both get inside of spirochetes and inside of cells, and they basically limit germ growth by blocking protein production. But here's the thing. They block it in different ways. So if you put the two together, you get a super blockade of protein production of the germ, so the germ has a hard time growing, okay? And then grapefruit seed extract in this is used to treat the cyst form of the germ. Okay? Another example would be to use a penicillin plus an azole. So you could put together an amoxicillin, which is going to treat the covering of the spirochete, and then you put it together with like a tinidazole that is going to treat intracellular Lyme and treat the cyst form of the germ. Okay. Another example is to put together a cephalosporin plus a tetracycline plus an azole. Again, this 3-drug combination, the cefuroxime or Ceftin, is your cephalosporin. It is working on the cell covering of the spirochete. The minocycline, your tetracycline, which is getting on the inside of the spirochete to block protein production, and it gets at Lyme living inside of cells. And then the Flagyl is your anti-cyst agent, okay? I covered this earlier, but my favorite herbal combination is to use this Otoba and cat's claw. My own clinical experience is that it works about 85 to 90% of the time, which is very similar to what prescription antibiotic combinations, the chance that they would work too, all right? The other one I like working with at times is this Biocidin LSF, which uses multiple herbs together to break down biofilm, to kill the germs, and to decrease resistance of the germs as well too. At least that's what the Petri dish experiments suggest, that this is how this works, all right? Another example is to put together tetracyclines with a rifamycin. And so that would be like a minocycline along with rifampin. The minocycline is treating intracellular Lyme and treating spirochete Lyme by getting inside. The rifampin is treating the cyst form of Lyme, also gets at intracellular Lyme, and But here's the most interesting thing about this combination is that this is also a combination to treat Bartonella. So if you've got a person that has Bartonella and Lyme, this is one way that you could go after both of them at the same time. Okay? All right. All right. So there's also IV antibiotic combinations. One way to do this is to put together ceftriaxone along with tinidazole. Okay, the ceftriaxone is a cell wall agent. It's working on the cell wall covering of the spirochete. Tinidazole is treating the cyst. Okay. Another regimen could be to use an IV macrolide along with grapefruit seed extract. So Zithromax, azithromycin, can be used in an IV form, and it can be combined with grapefruit seed extract, which would go after the cyst. The azithromycin here is going after spirochete Lyme and also at Lyme living inside of cells. Okay? All right. So I just want to highlight some special considerations about how you design antibiotics in Lyme disease. Okay? All right. So first of all, doing antibiotics alone is unlikely to get a person well if they have chronic Lyme disease. All right. And that is because there is this whole mess that gets created in the body by having a Lyme infection. So what I usually urge people to do is to look at my treatment protocol called the Ross Lyme Support Protocol. This includes various steps like getting sleep, lowering inflammation chemicals called cytokines, getting yeast out of your body early if you've got too much in your intestinal tract, but a variety of steps that you need to take to fine-tune the immune system to get it to jump in and start helping to get rid of the Lyme infection in addition to using the antibiotics, okay? All right, second point is that there's some science showing that if you do some starting and stopping of the antibiotics, it might be an effective way to deal with these persisters. The point I would make with it, though, is probably the best way to do pulsing would be like a 2-month on, 2-month off based on my own clinical experience, okay? All right. Another point I would make is that regarding intravenous antibiotics and oral antibiotics, generally oral antibiotics are going to work about 85 to 90% of the time. IV antibiotics may work about 90% of the time, so maybe 95% of the time, that is. So maybe a 5% increased chance of getting improvement by using the IV. But you got to remember with IV, they carry risk. And the big risk is that you could get blood clots that form when this IV line is left in your arm, because you have to use an IV called a PICC line. It's something that's left in the arm. The other thing that can happen, sometimes you can get infections. So usually in terms of IV, unless somebody had severe neurologic Lyme, if it was in the beginning of treatment, I often would start with using just oral antibiotics to begin with. And if we were not making enough headway, say 6 to 9 months down the road, I might consider doing IV antibiotics just because there's so many risks involved with them. Okay? All right. All right. Then finally, another thing that I would point out is there is what I would call IV equivalent treatments, things that work in a similar fashion to IV. One of those is to do butt muscle injections of bicillin instead of doing IV antibiotics. The other is to use extremely high doses of amoxicillin. So amoxicillin, we would normally for like throat infections give it as a 500 milligram pill 3 times a day. You could give it at high doses of 3 to 4 pills 3 times a day, okay? So 3 to 4 times as much as throat infections. The idea with that is if you take it at that high of a dose, you get really high levels in the blood, and so it can force its way into tissues just like IV antibiotics do. And in fact, I've had some wonderful improvements in people with their multiple sclerosis caused by Lyme by doing this when they got nowhere with IV antibiotics. Sometimes just doing this high dose oral antibiotics was an effective way of helping with that kind of a situation. All right. All right. So in terms of how long do you treat with a combination, generally I would leave somebody on a combination for about 6 months and then rotate off. And over that period of time, I might want to start seeing improvements, obviously. I will tell you, though, it takes time to turn the corner in Lyme, and there's some unpublished research that shows that in chronic Lyme disease, by 3 months of treatment, only 30% of people start having improvements. By 6 months, 60% start having improvements. And by 9 months, 90% start having improvements. So sometimes it's just a matter of giving time. The reason I would rotate antibiotic regimens about every 6 months is more out of a concern of developing resistance, the germs developing resistance to the current antibiotics that I would have somebody on. Okay? All right. So those are the big points I would make about how to design Lyme antibiotics. And again, I gave you some examples here as well too. Again, this is a lot of information, and it might be better if you actually just take time to read the article, but I know some people like to get their information in the form of video, which is why I created a video like this. So if you need more information, click on the link in the video description below this video.